The Abbott ID Now tests are the tests being used at the testing site at Twin River. The FDA announced yesterday that it is going to be looking at the Abbott test. It's a rapid test that's used to identify COVID-19. They are looking specifically at accuracy issues and are investigating whether they could be due to the types of swabs used or the type of viral transport media used, which is the material used to transport the specimen safely and effectively. It's important to know that we validated the Abbott tests at the Rhode Island Department of Health's State Health Laboratories when we started using them in Rhode Island. Our state health laboratories confirmed their accuracy. It's also important to know that our positivity rate at the Twin River site is about 11%, which is essentially the same as our positivity rate in Rhode Island for all tests at all sites. So it is comparable, and that's information that's helpful for us. Abbott tests have been very useful for us in Rhode Island. They've allowed us to start contact tracing on thousands of people very quickly and to get them into isolation very quickly. The key for us staying in front of this as a state is being able to identify the people who have been exposed, who are positive, and quickly get them into isolation, identify their contacts, and get them quarantined so that they can stay local, stay close to home, and monitor themselves for symptoms. That's the way to stop transmission. That is the greatest value that we get from these tests. However, we know that there are limitations to any test. One limitation to the Abbott test is that it is a little less sensitive than a lab-based PCR test that we're using. It is a point-of-care test. That means for the Abbott test, as well as for our lab-based PCR test, in a normal scenario, the test is one piece of information that a healthcare provider in the office would traditionally use when evaluating a patient. We understand that. It's one tool in the toolbox, and it is a critical one. A person's symptoms are also an incredibly important piece of information. That's why we have been saying for weeks that no matter what your test result says, it is extremely important for people to stay home and self-isolate if they have symptoms. We've also explained for the last several weeks that the test works less accurately, less reliably, if it's done on people without symptoms. And that's why we are only using it in those situations for specific reasons driven by the Department of Health when we want to use it to inform how we are evaluating the spread of disease. It's also why we have formed the Rhode Island COVID-19 Testing and Evaluation Task Force. We are very appreciative to these experts who have committed time and are already fully engaged in evaluating this test, the FDA antigen tests, the serology tests, to help make sure that all of us in Rhode Island have the information we need about how to use the tests best to our advantage. We are using many different tools to comprehensively understand the prevalence of COVID-19 in Rhode Island and to make data-driven, informed, science-based decisions about our next steps.